to get started? Yes. We'll call a meeting to order. Health Committee, August 2nd. I'll find my agenda. Are there any public comments? Hearing no public comments, do we have any agency reports? No agency reports. Iroquois County Public Health Department.
Good morning.
Good morning.
Again. I don't have a lot today. This will be a short meeting compared to the ones I usually do.
Hey, Terry.
Hey, yeah, not that short. Not that short. So, as you know, Iroquois Memorial Hospital has always subcontracted 3 grants from us. WIC, Family Case Management, and Healthy Families Illinois. They've now taken over Healthy Families Illinois and Family Case Management. The only grant that the health department is administering, or is subcontracting to them to administer, is WIC. But I do have, and I'll let you pass this out. I don't think there's copies in your packets, but I'll let you know that the WIC assigned caseload is 557 for Iroquois County, and they ended June, which was the end of the state fiscal year, at 431, which was 77%, which is above the state average. The state average right now is 72%. For Family Case Management, their assigned caseload was 182, and they ended the year at 163, which was 90%, which is well above state rate for that. And then Healthy Families Illinois ends up having a caseload of 27. But I think that they're, and I'd have to check this out with Ellen to make sure, but I think they're at maximum case weight. They aren't assigned a number that they have to reach. Each case is weighted depending on the needs of the family. So I think they're at maximum case weight.
I have a question.
Yeah.
The assigned, what's the term?
Caseload.
Assigned caseload. How is that determined?
That is determined on the number of children in Iroquois County who are Medicaid eligible.
So it is specific to the county. It's not a general average? Or
No, that's your case. Every county is assigned a different caseload according to what the number of people eligible in their county.
Yeah.
Mm-hmm. So that's pretty good that they're running, at those numbers, and they're above state average in all 3 programs. So they've worked very hard. I will also send around with that. I will send around a financial spreadsheet that shows you where we ended the year with them. There was about $20,000 that they did not expend of grant money. They are checking with the state because there were some expenditures that may or may not have been allowed to see about that. So Ellen's doing some checking on that. So we'll see what happens when we go, with that. But it won't end up being a loss to Iroquois County Public Health Department, even though we've prepaid them the set amount, because right now we collect their Medi money, so that offsets any loss. And then whatever's left in Medi money, above and beyond what we've paid them, then we will give that to them. And we did that last year. We wrote them last year a check for over $10,000. The health department does not make a profit, not 1 penny profit, from the services that they provide. So here are those sheets. I'll just pass those around. You can take a look at them. Today the state owes us $184,902.81, and approximately $160,000 of that are for the programs that we had subcontracted last year to IMH. We're still waiting, obviously, for a little bit of grant money, about $23,000, $24,000 at Iroquois County Public Health Department. But I've said this to you before, at any given month we're owed that, from what we billed from the month before, and we're waiting on payment. So we're not, the health department, as far as the health department goes, the state payments are not too bad at all. The Senate bill that passed last month included Healthy Families Illinois, and that $160,000 that we're owed for the IMH program, $152,000 of that is specifically for HFI. It was included in the Senate bill. They keep telling us that they will pay us as soon as money becomes available. So we're waiting on that. We're also still waiting on the state budget, as you know. So what I spent the last month really working diligently on is our budget. I have a budget to present to the Board of Health Wednesday night at our meeting, and that's ready to go. And if any of you would like to see that, by all means, just stop in my office, and I'll gladly take a look at it. What I also made with the budget was budget justification notes. So every single line item on my budget explains exactly what that money is going to be used for. So if you'd like to see that, I'd be happy to share that with you as well. If you look at our contracts list, which I handed out to you, that's our next thing. Obviously, with no state budget, contracts are late coming in. So we've been writing grants a lot later this year than we have the last 2 years. It's kind of frightening waiting on those. If you look, the preschool vision and hearing program is at the top of page 2. That one doesn't have anything there. That one I spoke directly with the Illinois Department of Public Health Program Manager for that. That grant was supposed to be released by July 30th. It was not released. So on July 30th, I gave her a call. She said it would be out within 2 weeks. So hopefully we'll have that very quickly.
2 weeks is almost up.
Yeah, I know. The dental sealant grant, I spoke to Stacey Baldwin at the state level. She said that they're still waiting on an appropriation amount from the state. As soon as they get their appropriation amount, they'll give us our amount. So, but we do expect that grant to come through too. The other one is the Tobacco-Free Communities Program. Your guess is as good as mine on that one. No one knows anything. You can call the state and they say, we don't know. I can tell you that over many, many years of public health service, that's the one grant that tends to be fund swept. The first year that we were in existence in 2014, in 2015 we were notified in March. Remember that they were going to fund sweep March, April, and May, and June. Or we were notified in March that they were going to fund sweep the last quarter, which was April, May, and June. They did fund sweep it, but then in the fall they reappropriated money back to it and paid us. So we don't know what's happening with this grant, and I asked, we had a regional administrators meeting last Friday, and I thought maybe some of the other health department administrators who have really long-standing relationships with some of these IDPH directors would know something more maybe and could give it, and no one knew anything. No one knew anything. So we'll wait and see. In the meantime, we're doing the minimum. We're not expending any advertising for the quit line or anything like that until we know if we can get reimbursed for that. So we're doing the minimum. So in other words, what we're doing is when they're out doing food establishment inspections, then they're doing compliance checks at the same time. Trying to kill two birds with one stone in case we don't get any of that money back. But the rest of the grants we're doing okay. We also know that $50 million was appropriated federally for Zika virus prevention, and that money will go to the states and then be filtered down to the local health departments. We have no idea what that will mean for our health department. I don't think the state knows what they're getting yet, so it might be a while before we know whether or not how much money we're getting for that. But we are getting directives from the state. They send out siren alerts to us constantly about Zika virus. I got some yesterday. Giving us instructions on testing, giving us instructions on
That particular breed of mosquito is generally
not
in the south,
yeah,
correct?
it's generally not found in Illinois. Now, the University of Illinois in Champaign and Champaign-Urbana Public Health District have traps that they're setting up to see if that mosquito, just like we collect our Culex mosquitoes for West Nile virus, they're trying to collect Aedes mosquitoes to see if they're in the area. If I know Julie Pride, the administrator, very well. She's wonderful. We have a wonderful, Iroquois County and Champaign-Urbana Public Health District have a wonderful cooperative working, relationship. So she would let me know right away. I know she would give me a call and say, uh-oh, guess what we just found? We don't have an HIV program here, so we've partnered with them. So we send all of our people who want to be tested for HIV to them, and she gladly takes them and treats them, just like, they're her own, and works very well with us, cooperates, and provides anything that we need help with. She's Johnny on the spot. We're very lucky. Most of the surrounding health department administrators are that way, so we're very, very fortunate. Melinda Hillman at Livingston County is always willing to help with anything we need. DC County, Vermilion County, we're very fortunate. After that, you'll see the programs list. Do you guys have any questions about the grants or contracts list? No? You notice, though, on that grants and contracts list, I think I might have reported this last night. We did get 3-year contracts with the schools this time instead of 1-year contracts, so that was nice. Under the program summary report, you can see that they've been pretty busy. Obviously, there were a lot of food sanitation inspections, a lot of temporary permits issued. I mean, that climbed, hugely. You guys realize that's from the fair. Usually we average 3, 4, sometimes only even 1 or 2 temporary permits in a month, and we had 30 in July. Obviously our mosquito samples are up. We had 24 mosquito samples. We had 1 bird sample that we sent to the state. Lynn Harriman sent me an email last Friday. It came back negative. So it tested negative for West Nile virus. Nuisance complaints shot up a little bit in July, but they typically do. People are outside, they notice other people's property and things going on more. Obviously our immunizations doubled, almost doubled, and they're going to, and they're probably going to triple or quadruple in August. You'd be surprised how many parents wait to get their kids their school immunizations. They have all summer and they wait till like the week or 2 before school starts. So that happened. 9 animal bites, 3 hepatitis C cases. Obviously the number of rabies investigations increased because of the animal bite increases, but as you heard from Dr. Yusuf this morning, those animals tested negative, so that's good. Just typical, normal caseload for, breast and cervical, community outreach, the jail program, school health services. Obviously, we don't do the vision and hearing screenings in the summer because school's not in session, and we do those in schools. So our numbers for that this month happen to be 0, which is unusual. Which is usual for July. They'll start back up. We'll have some low numbers in August, and then they'll start back up in September. You can see that senior services their community care program was very busy doing need-based assessments and nursing home pre and post screenings, those kinds of things. No TB cases. That's always a good thing to report, right? Any questions?
You're lucky.
Lucky?
No question.
No questions? So, we do have a Board of Health meeting Wednesday night. Hopefully the budget will be approved. I submitted to them last month a preliminary budget. We went over that line item by line item, and I made a few changes, and we'll be going over that again. We have one opening now at the Health Department. Deb Longest, who was a 25-year Health Department employee between both Health Departments, has decided to retire. She will remain on staff with us PRN. In other words, whenever we need her, we can call her and she'll fill in, help us with flu clinics, help us support, when we're really busy. Fill in. She was a school nurse for many years, so she'll help cover that if the school nurse is on vacation, which will really help us a lot. So she'll keep her nursing license active and be a tremendous asset for us when we need someone. But she's decided to retire, and she has been an unbelievable nurse. I'll put her nursing skills up against anybody. Deb's terrific, top-notch nurse. We're sad to lose her, but we have a posting on the county website and on the on the health department pages. So I'll be doing, and we've gotten some good applicants. I will be starting interviews probably on Friday, but we're taking the applications until Friday for that position, and go from there. But we've been very fortunate. We've gotten some good applicants, so it'll be a tough decision. So I look forward to the interviews.
Okay. Any questions for Dee? Or is that?
Yeah.
Oh, yeah, okay.
Thank you.
Thank you.
Thank you very much. Any other questions or observations for this committee, from the committee members? Is there any old business? No old business? Is there any new business? No new business. Is there any adjournment business? Brett? Dan? Second? For adjournment? All in favor, say aye.
Hey.
Opposed, say no.